Hi everyone, I'm Dr. Kylie Moss and I'm a specialist in sexual medicine with a focus on vulvovaginal disorders. I wanted to talk to everybody about vulvar anatomy today because the vulva is an area that's really critical for sexual function, and it's an area of the body that most patients don't have a lot of familiarity with, and it's not their fault. I was a high school teacher before I went to medical school, and I know we weren't doing a great job of teaching anatomy then, and I can't imagine it's much different now. Recently, the actress Gillian Anderson was photographed in a beautiful dress at an awards ceremony that had vulvas all over it, and all of the coverage in the popular press was about her vagina dress. And my little gynecologist heart broke because it was definitely a vulva dress, unless they were talking about her pockets. And I was just sad that we didn't even know the difference in this very basic way. Not knowing the geography makes it harder to treat gynecologic conditions. A good analogy is the mouth. Diseases that affect your skin on your cheeks are very different than those that affect the lips or the insides of the mouth. You wouldn't use toothpaste on your cheeks unless you have some wonderful beauty regimen that you want to leave in the comments. Of course, some of the conditions can overlap that affect both places, but just like the mouth, the cheeks, the lips, the cells of the vulva are very different than the cells inside the vagina and the vestibule, which is the transition between the two. Knowing your anatomy can help you describe an area of concern to your physician and may help target therapy to a particular problem that you're experiencing. So let's take a look at our anatomy diagram. I went with a skin tone that reflects the average skin tone in the United States, so that's why the color choice there. And the pink pubic hair is not only fun, but I also think it highlights something that's often minimized to promote a culture of youth in favor of more sort of unmodified aging. So I wanted to highlight that, and also I just think it's kind of fun. So going through the anatomy on this diagram, we're going to start working from the outside in. Starting at the top of the thighs, we can see these creases that are the boundary between the legs and the vulva, and these are called the groins. We look for a couple different conditions in the groins. Things like yeast dermatitis or irritant dermatitis can be common, but we also see things where patients have inflammation and cystic changes in these areas, along with some areas that can drain in a condition called hidradenitis suppurativa. And that can require topical antibiotics or oral antibiotics, depending on the severity. It can even require surgery. So that's something that we'll see in the groins. Sometimes we'll also see swollen lymph nodes in this area, and that can be related to an inflammatory condition of the vulva or the legs. And it's really important, if you notice new bumps in these areas, to have them examined. Next, looking at the top of the diagram, there's this area called the mons pubis, which sits over the sort of bony symphysis pubis, which is part of the pelvic bone. And the mons pubis is an area where there's usually pubic hair, and it is susceptible to any of the other conditions that hair-bearing skin can be susceptible to. So things like folliculitis, which is irritation from shaving, we see in this area a lot. We can also see things like irritant dermatitis, so an area that we definitely want to examine closely, especially if you're having pain or irritation there. Moving down, there are two areas of skin on either side, one on either side of the vulva, that meet at the base of the mons pubis, and these are the labia majora. The labia majora also have hair on them, which is what distinguishes them usually from the labia minora, which are more inner or medial to the labia majora. They are susceptible, though, to changes in inflammatory conditions like lichen sclerosis. And so if you were to have whitening changes, itching, and irritation, definitely something that you would want to get examined. Now, zooming in just a little bit, we see at the top, in the middle of the labia majora, there is a hooded area, and that is the clitoral hood. or sometimes called the prepuce. The clitoral hood is a flap of skin, can be different sizes or shapes for everybody, that covers the clitoris. We sometimes see that it can get stuck down on the clitoris in people who have inflammatory conditions, and that can cause decreased sexual sensation. Because the clitoris is so important for orgasm, if there's a flap of skin over it, it can help to protect the clitoris, but if it's stuck down, it can also affect orgasm and sexual pleasure. The other thing that can happen here is that the hood of the clitoris, if it is a little bit stuck down, can trap the dead skin cells underneath, and they can get hardened into something called a keratin pearl, which can be very irritating and painful. We also sometimes see people that have shaved and have actually pubic hair stuck under the clitoral hood, which can be actually really cause sharp stabbing sensations, be very painful. So it's certainly an area that is neglected and needs to be examined more. And so we usually try to examine that very closely when we're seeing a patient for the first time. Underneath the clitoral hood, unsurprisingly, is the clitoris. The clitoris is one of the most sensitive areas of the body, really important for sexual pleasure. If you're having muted orgasm or you're having difficulty achieving orgasm, you definitely need a really good examination of the clitoris, or, of course, if you're having pain there, it's something that a gynecologist should look at. And we've only recently recognized that the anatomy of the clitoris is much more extensive than previously realized, and in fact is much more like this in size and shape, can be sort of in the 3 to 7 inch range, very much larger than you appreciate on the surface. And so it's a pretty impressive organ, and one that needs to be studied more. All right, so moving down inside the labia majora, we have more freely moving flaps of skin called the labia minora. I really felt it was important to represent that labia minora are usually not symmetric. They also come in all different sizes. So I represented them in a couple different sizes here, just to hopefully make everybody appreciate that no two labia and no two people have identical labia. The labia minora can be really affected by skin conditions like lichen sclerosis, which can cause them to be scarred or less prominent. Inside the labia minora, you'll notice, if you're looking with a mirror at your own anatomy or looking at an anatomic picture, that there's a textural change from the outside of the labia minora, or the closer to the outside labia minora, to the part of the labia minora that's closer to the vagina, or we would call more medial, more towards the middle. And that textural change, where you go from sort of darker, more textured skin to smoother, more glistening, usually lighter pigmented skin, is called Hart's line. And it is the transition between the labia minora and an anatomic area called the vestibule. The vestibule is a ring of tissue that surrounds the opening of the vagina, and it's really important because it provides a lot of the body's natural lubrication. And when there's not enough hormone in the area, it can be an area that's very painful, particularly during insertional intercourse. So it's really important to have a good exam of the vestibule, because if you have significant pain in the vestibule, for example, by touching it with a Q-tip, then it may mean there's a concern about a lack of hormone to the tissue. The other thing that can happen in this area is you can have a lot of extra nerve endings, and extra nerve ending in this area can tell your brain that there are painful signals, even when the signal that is being sent to the tissue, for example, by just a simple Q-tip, it shouldn't be painful. And that's something called neuroproliferation or neuroproliferative vestibulodynia, meaning lots of pain in this ring-like area at the vaginal opening. And that can be really debilitating for patients, and something that requires usually medication or even surgery to fix. Next, we see a circle in the vestibule, and that is called the urethral meatus. The urethral meatus is the area that drains urine when you go to the bathroom, and it is much more like the tissue in the vestibule than it is any of the other parts of the vulva. So just to be aware that that's a landmark. So if you can feel the opening of your urethra, then you know that you're in the sort of same ring that is where the vestibule is. Next in our diagram, we see this ruffly tissue that's inside the vestibule, and that tissue is called the hymen. The hymen is an area of the body that comes from the top or more inside part of the vagina, meeting the vestibule, and they join together in a single sheet of tissue that then opens to become the hymen. Sometimes this sheet of tissue opens so much that there's really no detectable tissue. Sometimes the sheet of tissue opens so that there are parts of it that are visible and parts of it that are sort of absent as you work your way around the opening. And sometimes there is thicker tissue that works its way all the way around the opening of the vagina. I say this because there are some misconceptions culturally about hymenal tissue and it representing sort of, and it being completely circumferential or going all the way around the opening in patients who haven't had intercourse yet. And that's just not true. Some people are born without this tissue entirely. There are also conditions where the hymen doesn't open or it opens only a very small amount that can affect menstruation and sexual function and can be really require surgery to fix. So it's a very small area of tissue, but one that has like a lot of cultural and medical significance. And so inside the hymenal remnant is where we find the vaginal canal. There's a lot we can say about the vagina, but this video is really going to focus on the vulva. So we'll zoom back out and just look at the structures that are around the vulva because they're important too. There's this area between the vulva and the anus called the perineum, and it's an important area that can be easily affected by things like yeast dermatitis or lichen sclerosis. There's also below that the anus, and that area can be affected by some of the same areas that affect the vulva. So things like lichen sclerosis, yeast dermatitis are things that we see not only on the vulva but also on the perianal skin. So to recap, I think there are lots of different anatomic structures that are part of the vulva, and knowing the anatomy can be really helpful for your gynecology clinician to help diagnose and treat any concern you may have. I hope this video has been helpful. If you have questions about any of the conditions or you have other ideas for videos that I can do that would be helpful, please leave them in the comments. Thanks and have a good one.